Hi, thank you for joining us today in our conversation about, are we still live? In our conversation about HIV prevention and screening. My name is Josh. I'm a physician assistant here with Grace Health, and I'm joined here with the very intelligent Brian, who is a pharmacist here at Grace Health as well. To start out our conversation, I want to talk a little bit about HIV and AIDS. It's a pretty common terms that we hear a lot, and I want to discuss it a little bit more. HIV is the name of the virus that affects our immune system, so it hijacks our immune cells and makes it harder to fight off infections. And we can get infected from people who have already had HIV through bodily fluids, including semen and blood or vaginal fluids. So for example, HIV can be transferred if we have sex with somebody who already has HIV without a condom. Also, if we share needles or syringes with somebody that's already been infected with HIV. And like I mentioned before, HIV makes it more difficult for our body to fight off infections and cancer. The other term, on the other hand, AIDS, is a term that healthcare providers to describe the stage of HIV infection when our immune system is at its weakest. Currently, unfortunately, there is no cure for HIV. However, there are medications that are extremely effective in caring for HIV. And Brian, I don't know if you ever heard the term U equals U, but when we get that viral load down very, very low, it's unlikely to transfer from person to person. So U equals undetectable, so U undetectable can mean untransmittable, which is why it's important to know our HIV status and to have regular testing.
So Josh, how severe of an epidemic is this in our area?
Yeah, so in Michigan in 2020, there were about 16,881 people living with HIV. 519 of those people were newly diagnosed with HIV. In Battle Creek, I don't know if you know this, is one of the most affected areas in our state, which kind of transitions into PrEP. And Brian, can you tell us a little bit about what is PrEP?
Yes, so PrEP is a group of 3 medications that are used to prevent HIV transmission. It stands for pre-exposure prophylaxis, and anti-HIV medications can actually keep HIV-negative people from becoming infected. And if used appropriately and taken regularly, it can even be used in a way similar to a vaccine, only it's a daily or every few weeks injection or pill.
And how effective is PrEP, and how long would a patient or a person have to wait before it starts working?
Yeah, so it's would start working about after 7 days of daily use, and that would be for receptive anal sex, for receptive vaginal sex and injection drug use. PrEP reaches a maximum protection about 21 days after daily use, and no data for PrEP effectiveness is out there for insertive anal sex or insertive vaginal sex. And there isn't any data for injectable PrEP for reaching maximum protection. That's that new formulation that is out there. That now, as far as formulations, there is the three types that I mentioned. There's Truvada, Descovy, and Apretude. Truvada is emtricitabine, tenofovir, disoproxil fumarate. Descovy is emtricitabine, tenofovir, alafenamide. Both of those are an oral option that is taken daily, as I was saying. Descovy is only for folks who are assigned male at birth. It's only approved for those folks. And then Apretude is an exciting new option that is injectable every 8 weeks. And it is great for those who don't want to have to take daily medication. As far as effectiveness, it is great at reducing the risk of getting HIV from sex. In fact, it's near 100%, or about 99% when taken as prescribed. It is less effective among people with IV drug use, 74% when taken as prescribed. And it should be taken as prescribed. If doses are missed, then alternate methods of protection should be used.
What are some of the side effects that I could expect if I wanted to start taking this medication?
Yes, so Cabenuva can cause some injection site reactions, which basically just means that there's some swelling and irritation at the site where the injection was, not unlike, say, a vaccination. And then it can also cause just some mild fever or headache, pretty similar to a vaccination. Truvada should not be taken with high-dose non-steroidal anti-inflammatory agents such as ibuprofen, because it can actually harm normal kidney function. And it can also cause decreases in bone mineral density. So for folks who have osteoporosis or similar disorders, they should talk to their doctor about other treatment options, which could include the medication Descovy, because it doesn't have as many of those same concerns. Now, the health benefits of PrEP medication usage are known to widely outweigh any of the reported risks to most patients.
So most patients tolerate it pretty well? Yes,
it's tolerated pretty well, and it doesn't usually cause any severe side effects with most folks, except in the situations I said with the osteoporosis or with reduced kidney function.
So one might ask, if you should talk to your medical provider about PrEP. And the CDC has put some guidelines out there, and for people that have had sex within the last 6 months with inconsistent condom use, have had a sexually transmitted infection over the past 6 months, or have a HIV positive partner, are all really good candidates for it, as well as patients that may share drug equipment. But there could be also other indications, and so it's always really good to have that conversation with your medical provider and see if PrEP is right for them.
So I hear that there are some tests that need to be done if I decide to start this medication. Which tests will I need to complete?
Yeah, excellent question. So, when we're starting PrEP, we want to screen for hepatitis. We want to see if there's any new infection with HIV, and we want to check your kidney function and liver function to make sure that it's safe taking this medication. PrEP does not cover other sexually transmitted infections, so it's always important to get routine screening for these sexually transmitted infections every couple months, as well as continue to monitor, your kidney function and liver function as well.
So what do I do if I feel that in the future my lifestyle changes a little bit and I feel that my risks for acquiring HIV have changed? What can I do? I mean, should I continue taking it? Can I stop taking it? Under those circumstances, what happens?
So it's always a great thing to talk to your provider about both that. We still want to do some screening after stopping PrEP. We want to check for, again, check for hepatitis, because if you had a hepatitis infection and you were on PrEP, there is rare cases where that can get worse while taking the medication. A lot of people ask about adherence to the medication. Oral PrEP is best when it's taken daily. There are other methods of taking it, such as the on-demand, or AKA the 211 method, but that's a great conversation to have with your provider and see if that's a good option for you.
And then if I decide that this medication is right for me with my provider, my medical provider, how much might it cost for me to obtain these medications or get these medications?
Yeah, that's a great question too. So, most, or many, I should say, private and public insurers, they do cover PrEP. The co-pays and deductibles vary. But there's a lot of programs out there to help with the cost. There's federal programs such as the Ready Set PrEP. There is state programs through Medicaid to help cover the cost, as well as Healthy Michigan Living. And then we even have local programs here at Grace Health Pharmacy for particular patients that qualify. We do the sliding fee program, and generic Truvada is available at $9 a month.
Wow.
Yeah, so the cost of a dozen eggs in this economy. So. And there's the manufacturer. The manufacturer also has assistance programs. And since we're on that conversation, there's also local programs that help with testing. So there's the CARES program that offer free testing here in Battle Creek and Kalamazoo. So that's also another great option for patients and for people out there. I'd like to end this conversation before we start taking questions. Today's conversation, we wanted to kind of take out the stigma of HIV and PrEP so that we can be more open in having those conversations with our providers and medical professionals. You might have heard that an ounce of prevention is worth a pound of care. So it's always great to have those conversations and know your status. We're going to open up questions, and if you want to add questions into the comment box. If you want to add a private message, you can also do that as well. And we'll be doing a raffle for these lovely gift baskets. So one of people that we'll select will be getting a gift basket. And then we do that they'll put once we select somebody, they'll have get their information. Is that correct?
Name and phone number.
Name and phone number. So we'll get your name and phone number through private messaging. Any last thoughts or anything that you have to add before we start, Ed?
No, I just wanted to add that these are magnificent gift baskets. They're full of all these over-the-counter items that come from a pharmacy that anyone could use, and it's cold season right now, so there's a few things in there that could help you out.
Yeah. Comments. So I see one comment. So our first question, what are the symptoms of HIV? Well, that's a great question. So symptoms of HIV can be very vague. They can be body aches, fever, chills, rash, but symptoms don't always occur, and you can be asymptomatic. So again, this is always so important to get regular testing and to know your status. Next question. How long after initial infection does HIV appear on testing? Well, that is another great question, and it's not always straightforward. So, results are very dependent on what kind of test that we do, and may vary. We might get results back, or might show up initially in 10 days up to 90 days. And there's multiple ways of testing. So, we can test for antibodies, antigens, and nucleic acids. It's very dependent.
Or how often?
Okay.
Keep testing.
Yeah, so that's a great question too. Once you're on PrEP, I think the question is, like, how often do we retest for HIV? And that, to answer your question, it would be like every 3 months that we would be testing for. What if I miss a dose? So, with this medication, if you miss a dose, I wouldn't sweat it. It's still very effective medication, even with missing a dose. And I'm actually glad that you mentioned that, because we also have some statistics. There's been studies out there that if you take it 7 days a week, you're 99% effective. But even if it's 4 days after you have that initial period of taking it, 4 days is still like 96% effective according to some of these studies. So even one dose, if you miss one dose, you're still very much protected. But obviously, the more that you take it, the better adherence that you have, the more effective this medication is. Did you have anything to add to that?
Nope.
No? Okay. So, the next question we have is, what is the first step if someone is at risk for HIV and doesn't have a doctor? So there are programs like the one I mentioned before that does free testing through our community, but Grace Health is accepting patients. We have PCPs here that would love to see patients, and so if you're interested, we can put some of those resources on the website, as well as you can stop by Grace Health and see if there's what our next availability is. And I have the bone density loss on this medication. Did you want to answer this one, or want me to answer this one?
Go ahead.
Okay, so the bone density, it was very, very small from the studies that I've seen. It was less than like 1%, and very, very small with chronic use. But those risks are very, very small.
And I'd also say that they're a bit transient. After stopping the medication, or if you come to that decision with your doctor that taking it isn't appropriate for your current lifestyle, then the bone mineral density has been shown in the studies to return back to what it was.
Yeah, good point. So, what do you want us to mention about the baskets? Oh, yeah, so again, for people that ask questions, we can we put you in a raffle to get some of these baskets. So 2 people that tune in today and ask questions will be receiving a gift basket. Oh, yeah, and please just put your name and contact information in the private message to Grace Health. Another question, can a person with HIV take this medication? So that's a great question. Did you want to answer this one? I know we were talking about this earlier.
Yeah. So a person that already has HIV, it's not necessarily appropriate for them to take these medications, at least in the form of PrEP. Truvada, Descovy, and Apretude certainly are used in the treatment of PrEP, but they by themselves, each of those 3, do not make up a complete treatment regimen or a complete treatment plan for those who actually already have HIV. So if someone did end up getting HIV even once they were already taking it, you would want to definitely talk to your provider, and you would be changing your medication to something that would more appropriately treat someone who's infected with HIV.
And I guess just to add to that, I know that we were talking about this earlier, but the reason for that is we don't want to develop resistance with these medications, and that's why if we do test positive for a HIV while on PrEP, it's important to stop medication and to take the next steps in treating that. Are there other? So next question: are there any other medical conditions a person could have that would prevent them from being a good candidate for this medication? I think we kind of talked about it before, but people that have decreased kidney function or lower liver function, lower bone density might not be ideal candidates. However, that is a great discussion to talk about with your provider. Okay. So if you ask questions today, feel free to put your contact information in the private chat through Grace Health so that we can enter you in for a raffle.
Yep, just go to the Grace Health page and use Messenger to send a message to the Grace Health page.
Oh, yeah. So if you have any anonymous questions that you want to put out there, you can also put that in the private chat as well.
Fantastic gift baskets.
Thanks,
They're just waiting to be given away.
Oh. Well, we talked about, programs that Grace Health offers. So we do the sliding fee discount, which is a great opportunity for patients in our local community. And I don't know, anything.
Yep. So with that sliding fee discount, I know that access to PrEP for some people and some insurers, I mean, it can be in the hundreds of dollars for them to obtain this medication. So that sliding fee program that I was referring to, that is for folks who see Grace Health. They come here and use our clinic for their primary care here. And either those prescriptions are written by one of our fantastic prescribers, such as Josh here, and or if one of our prescribers decides they'd like to refer out with a referral, we can also use that fantastic sliding fee discount.
Oh, we got another question. Are there any drug interactions a person should be careful of if they are considering adding PrEP to their routine? So that's a great question. Thank you for asking. It's very dependent. There are medications out there that are liver metabolized, can be metabolized, so they go through our kidney, liver, and again, it's always super important to have that conversation to make sure that you're an ideal candidate with your provider, or even discuss it with your lovely pharmacist. So we're going to wrap up our live presentation. Thank you everybody for reaching out. Thank you everybody for making those comments and listening. If there's anybody that wants to message their information after commenting, again, we're doing a raffle, so feel free to do that as well.
And also, if you have any questions about PrEP or starting PrEP, just give me a call. Get Brian here at Grace Health Pharmacy, and I'm more than happy to answer your questions.
Excellent. Bye.